And for more perspective on this, let's bring in Precious Robinson, who is currently serving as the Chief Technical Specialist for Prevention, Care and Treatment at Health NGO Right to Care in Johannesburg. Precious, South Africa continues to carry the highest burden of HIV-AIDS infections in Africa. What has the country been getting right over the years?
Thank you very much, and good day to your viewers. I think what other countries can learn from South Africa is that South Africa over time learned from its own mistakes, and then it brought about a collaborative effort where government itself, from the political perspective, committed to making a difference. They then came on board and changed how their policies were addressing issues of HIV. And then in that, they embraced your donors and implementing partners, civil society, and people who were geared up to implement HIV and AIDS programs. The donors and implementing partners like Right to Care were then given an opportunity to support government efforts to deal with HIV and AIDS. And what I can say came up as a game changer, it's the government's drive to change each and every policy and guideline depending on what researchers would find as being most efficacious regimen, being most efficacious interventions that the country could use. And with the buy-in from government and the commitment financially and with other resources, South Africa saw itself getting the biggest program, putting a lot of people on treatment and driving a lot of HIV and AIDS prevention interventions.
And Precious, what challenges exist, especially with regards to ensuring there's adequate supply and access to ARVs?
Well, challenges will always be there, and it's good to see that despite the fact that here and there are some hiccups, South African government worked with implementing partners to make sure that the patients or people who are living with HIV actually access their treatment even during the COVID-19 lockdown. We have seen that because of the lockdown, transportation, flights and whatnot, not flying in and out of the country, supply was sort of compromised. The manufacturing was also compromised. And as a result, some of the antiretroviral drugs that were required were not available for patients to be able to access and use. And I think we all need to acknowledge the fact that during lockdown, there was a lot of challenge with respect to access, availability, and also anxiety from the beneficiaries of the services, because people were fearing, if we go to the facilities, are we not going to be infected? Meanwhile, the facilities or the services were also burdened by COVID-19, and with some of them being infected, some of them being in either quarantine or isolation because they would be affected. And the system was sort of overloaded. And as a result, not just HIV and AIDS services, but we saw almost all the services, including your non-communicable and other communicable diseases, child health services, maternal and child health services, sort of suffering a backlash because there was minimal access and there was minimal service provision. And on the other hand, you would remember that movement was restricted, and people who were supposed to be going to facilities to collect treatment were sort of having challenges because at times they would be meeting your SAPS or your army people on the road asking them, where are you going to or what? And that in itself would have hampered people going to the facilities. And we saw moving from all the levels of lockdown from level 5 and up until where we are now at level 1, government implementing some strategies to sort of mitigate on all those challenges that we saw hampering our services in the HIV and AIDS
If I may just jump in at this point, Precious, talking about government putting in measures to mitigate some of those challenges that the country has encountered, let's just broaden it. What should African governments do to keep HIV in check and also help improve the quality of life for those living with the virus?
I think we all need to acknowledge that COVID-19 has taught us lessons. And from the South African perspective, I think what we learned is that government needs to work in collaboration with implementing partners, donors, civil society, and the communities as the beneficiaries of services. We saw government allowing implementing partners, researchers, academics coming together, assisting with ways of mitigating on all what we were experiencing on ground on service provision. And implementing partners like Right to Care, funded by USAID, came with innovations. I mean, in each and every pandemic or any situation, you have to have a way out. You have to have a mitigating factor that will be able to assist you in coming out of the situation that you are in. And we saw Right to Care with other implementing partners, supporting government through the Ministerial Advisory Committee, through the IMTs. But then we also had in our, at the regional level, in our provinces and countries that we are supporting, implementing your differentiated models of art delivery, your locals, getting people to go to patients where they are at facility or at community level, visiting people at home, calling them, checking on them as to whether they're still having enough supply. And I think the implementation of multi-month scripting and dispensing, where people are given a few months, 3 to 6 months supply of antiretroviral therapy and other treatment, assist in cases where now people are unable to come to the facilities. And I think also where you found that innovative ways like your CCMDs and then your CDUs, which is sort of an ATM that people can go to and access the treatment, alleviated most of the challenges that we are seeing. And as an implementing partner, Right to Care has that potential, and I think other African countries can learn from that. Okay. We have, if I may mention, assisted during pandemics, like during the Ebola in Sierra Leone as Right to Care to mitigate such pandemics. And I think other African countries can learn from that activity.
All right, Precious, we appreciate that. Thank you very much for joining us. Precious Robinson, live for us there in Johannesburg.